Okay. Dr. Ekram, do you hear me?
Yeah, what about you?
Okay. Now I think we are able to start.
Okay.
So welcome everybody. My name is Luca. I'm one of biomedical engineer of the 3DM. Today we are going to follow a lecture with Dr. Khaled Ekram. Khaled Ekram is one of our pioneers in specialty of dental radiology and digital dentistry worldwide. He participated in many lectures as an international speaker and many continuous education courses or workshops in CBCT and digital dentistry as a speaker as well as an expert trainer. Currently, he is an ambassador of DDS, so Digital Dentistry Society in United Arab Emirates, and a scientific board member of DDS Arab Union. So I'm very glad to introduce you, Dr. Ekram. Welcome to be here, and thank you for joining this opportunity for us to share with you also this presentation. So when you want, you can start.
Okay, thank you very much, Luca, and thanks for 3DM for hosting this lecture to give me the chance to share my knowledge with all the audience and all my colleagues. Our topic today is about computer-guided implant surgery from virtuality to reality. Actually, we have our objectives today is to understand the components and types of implant surgical guides and understand the steps and workflow for designing different implant surgical guides, and to know the methods for preparation for immediate temporization, and to illustrate some interesting cases. So, what is the surgical guide? This is the important thing to know. It's a digitally designed device used to assist in the preparation of the implant site regarding the drilling position, the drilling direction, as well as the drilling depth. So why is the surgical guide is important? The digitally designed device, it transfers the virtual radiographic preoperative implant planning to the real surgical position so that you can make your own planning on the CBCT, on the bone, which you cannot see by the naked eye. And you can design a device that allows you to enter in the predetermined position that you see suitable during the planning. So this is the idea of the surgical guide in general. So to know the importance of any device or anything, you must see what may happen if you don't use this device. So any problem in the drilling position may result in something like this, or error in drilling direction can cause some perforations or injury for vital structures. And in drilling depths also you can make some serious complications like injury for the inferior alveolar canal, like this case. So this is a reported case showing a simple case of single implant inserted with a surgical guide. We have here a missing upper left first molar. Here is the virtual preoperative planning. When making a surgical guide based on this planning, this is the X-ray or the CBCT after insertion of the implant, and you can see the orange body here, orange color here, is the representation of the preoperative planning superimposed on the post-operative insertion of the implant. We can see here very minute error, or nearly there is no error. So how this surgical guide is produced? What is the idea of producing this surgical guide? The surgical guide is a digital technology or implant or computer-guided surgical stents. It's a technology where the guide is designed on the computer by special third-party implant planning software. Then it is manufactured using a 3D printer or sometimes by CAD/CAM milling. So you can see here in this picture, the yellow part is the digital model of the patient, and this red body is the design for the surgical guide body. So here, and then after introducing this design to the special machine like a 3D printer, we mainly manufacture the surgical guide by 3D printers, not CAD/CAM. So we are able to produce and 3D print the surgical guide exactly like was designed before. So what are the components of the surgical guide? The surgical guide has many components. First is the surgical guide body, which is in yellow, and there is sleeves, white sleeves, which is a little bit wider for insertion of the implants. And there is another sleeve, which is narrower, is for insertion of the anchor pin or the fixation pin, which is used to fix the guide. This is going to be discussed in details later on. So here we have here, this is the sleeve, the implant sleeve. This implant sleeve is specific, perfectly fitting with its corresponding drill, which is used to insert the implant or drill for the implant. And the other sleeve here that we have is this narrow sleeve, which is also specific for the fixation or the anchor pin. So this sleeve should be exactly fitting to the drill or the pin. If it's loose, then the drill will not be properly oriented if it's loose. But if it's tight, the drill will not be able to enter. Then we have the surgical gap body, which is blue. This surgical gap body holds the sleeves in place, as well as it is resting on the patient's mouth in order to start our surgery. So why is the surgical guide or the fabrication of the surgical guide is complicated? Why it needs some special skills? The structures participating in the implant planning procedure in the patient's mouth are the bone, the teeth, and the mucosa. So the guide will rest on one of these structures. And a lot of cases, we need at least two of these structures to be showing completely. So here we have, this is the teeth, and this is the mucosa, and this is the bone. But the question is, do we have a modality that can get all of this data in one shot? Like one machine can get the three structures accurately in something like this picture on your right? The answer is no. And we will know why it's no when we go through the presentation. So the idea of the software used for implant planning and surgical guide fabrication is to get each of the structures that mentioned before alone, and then trying to align these structures in the correct position. So, for example, here I have the bone of the patient and the model, and here I can assemble or align the CBCT having the bone. This is in gray, white, and black, with the outline, this orange outline, which represents the digital model of the patient. And this concept is called the virtual or the digital patient, that I have an assembled patient. This is not a shot for a patient. This is an assembled image for the patient. So the bone of the patient is used mainly for implant planning. The teeth is used for supporting of the guide, and the mucosa as well is also used for support of the surgical guide. Therefore, in computer-guided surgery, many steps and devices should be used in order to acquire and integrate all of these data together in a correct way. So we need here special implant planning software, we need hardwares, we need surgical guide, as well as the surgical kit and accessories. Maybe will be discussed in later presentations. For the implant planning software, I want to thank 3DM. All the cases which going to be presented today is done with the real guide, and some of them with the help of the Plasticad. The hardware which is going to be required, we have two types of hardware, acquisition tools and manufacture tools. The acquisition tools which are going to be needed during surgical guide planning and fabrication is the CBCT and the optical scanning. For the manufacture tools, we mainly use 3D printers to manufacture the surgical guides. For the CBCT shows the bone details only. So here is the CBCT where we make our implant planning inside the bone. But the problem with the CBCT that it has some limitations. Number one, it doesn't give any soft tissue information. Number two, sometimes the bone information may be altered, or the teeth information, because of some metal artifacts coming from scanning a patient with multiple metal restorations. For the teeth and mucosa, optical scanning or intraoral scanning are used in order to make scanning for the surface of the model or directly on the patient's mouth. But the problem here that it only gives the surface layer, doesn't give any information about the info on the internal structure of the bone. So these are the types of surgical guide. I'm going to discuss each type with the workflow. We have mainly three types of surgical guide. We have the bone-supported surgical guide, tooth-supported surgical guide, as well as the mucosa-supported surgical guide. For the bone-supported surgical guide, it's from its term, it's bone-supported, which means that the patient is totally edentulous, and a flap is going to be raised in order to support the guide on the bone. This means that what I need here only is the CBCT, because the planning is always done on bone as usual, and in this case, the support is also on the bone, and the bone we can get it from the CBCT. So only the CBCT only can be used in this case. So here is the workflow. We make the CBCT, and then we make our implant planning. Then there is something which is very important, is the thresholding. This thresholding means we convert the DICOM of the CBCT. We make segmentation and thresholding in order to convert the CBCT into a format which is similar to the digital models. So here we make thresholding and check that this bone is good, and we convert it into STL, and this STL structure will be used for planning of the surgical guide. Now the bone, after converted to STL, the implant planning is transferred to the STL of the bone, and the guide is designed, and then it is 3D printed. So for the tooth-supported surgical guide, here the surgical guide is supported on the bone, on the teeth, and the implant planning, as usual, always done on the bone. So here I need the teeth and I need the bone details. So here I have to make surface scanning of the patient's mouth in order to get the teeth clearly. So here we choose some points on the CT and some similar corresponding points on the surface scan of the patient, and then the CBCT and the optical scanning are integrated together in order to form the three-dimensional or the three-structure combination. Then the surgical guide is determined on the surface of the model, and the implant planning is transferred to the model, and the surgical guide is designed and going to be built. For the mucosal supported surgical guide, this means that the patient is totally edentulous, but here no flap going to be raised. So what we have here, if we make CBCT for the patient, I will have here pure bone, while the optical scanning of the patient's mouth or of the model of the patient will give me only the soft tissue. So here I don't have any single point which is common between the two scans. Therefore, something called dual scan protocol is done by making a radiographic stent, either by getting the patient's denture and attach Gataperca markers on it, or use a ready-made extraoral marker device to be inserted in the patient's mouth with the help of impression material or a bite registration material. So the scan of the patient will look like this, and the Gataperca markers will appear similar like this. And this is the scan of the extraoral marker. So here is the technique how it is done. The patient wear the denture with the markers and scan with it, and this denture with the markers is made for another scan alone on the CBCT machine. We will have the two scans for the patient's bone and the denture, and here we have the common points that we have created, which are the Gataperca markers, and then they are integrated together in order to form the surgical guide with the implant planning transferred to it. And this is called dual scan protocol. So what are the steps for the implant planning? For the implant planning, there are a series of steps that should be taken. Number one is making the intraoral or extraoral scan for the patient's jaw, and should be made in STL. And then the prosthetic planning, which is the virtual wax up, and then the CBCT scanning. We're going to pass on these steps in details. So first step, we're going to make the scanning for the patient's model or the patient's mouth using the optical scanner. So we have here the optical scan for the patient's model. Then we integrate the opposite arch, and then digital or virtual wax up is done using the software. And this prosthetic simulation, of course, is compatible with the adjacent and the opposing dentition. Second step, or can be done in coordinates or in parallel, which is the CBCT scanning. Here, the CBCT is integrated together with the model of the patient, together with the wax up. And some ask me how the wax up is integrated. There is no common points between the wax up and the CBCT. When the wax up is aligned with the model, and the model is aligned with CBCT, the software, especially the one that I use, this is the real guide, allows the wax up to enter in the same relation or previous relation which was scored with the digital model of the patient. Therefore, when we align the CBCT of the patient with the patient's model, the wax up also will be aligned in accordance. Something very important here, and this it's available in the real guide software, that the error for registration, which means if there is any error, any malalignment of the two scans together, can be measured. As we measure here, it's small but going to be magnified here. Here it is 0.052 millimeter. So this error, how it is evaluated or how it is considered by literature, if the error is more than 0.35 millimeter, then this is not acceptable. If it is below 0.1 millimeter, which is 0.0 something, then this is a very good registration value. Because if the registration is not accurate, therefore, the implant planning that we are going to do will be directed to another implant site that we have determined. This means that a failure most probably will happen. The majority of cases having error in registration will have a failure. So then the CBCT here is integrated with the optical scan and the wax up, digital wax up. Then the implant planning is done with prosthetic-driven maneuver. So here we can see here the implants are parallel, nearly parallel to each other, and here I will have a good restoration because prosthetic-driven planning gives better aesthetic and functional results. And we can see here also we have the fixation because any edentulous patient, like totally edentulous patient, need at least 3 fixation pins. If we have bilateral free end saddle, we will need at least 2 fixation pins. And for the unilateral free end saddle, we need at least 1 fixation pin in order to fix the guide in place. Then the guide is going to be drawn on the model. And then the guide here is designed on the model of the patient. And you can see here, this is the direction of the drills and the pin. Then after the guide design is done, the guide is introduced to the 3D printer in order to be produced. This is the 3D printed surgical guide. There are some important considerations because a lot of people, especially who are surgically oriented, are asking why we should do prosthetic-driven implant planning. So when we answer this question, you should answer with one, what if we don't? So let's see, what if we don't consider the prosthetic planning and do the implant planning directly? So here I have if I make the implant planning based on bone-driven maneuver, then here I will see which areas where the bone is good, where the bone can get wider or taller implants. So here, when I make the implant planning in this manner without considering the prosthesis, here the restoration will be very difficult, or it's going to be non-aesthetic. We can see here the implants are in the interdental spaces, or the areas that's supposed to be having the interdental spaces. While in case of prosthetic-driven implant planning, we plan the prosthesis first, and then we can make the implant planning correctly. And this can be also go further with immediate temporization. So the process of preparing for immediate temporization, I'm going to see a case in details, which is showing immediate temporization. During implant planning, it is possible for the software to propose to insert a virtual scan body. So here, this is the virtual scan body. It is aligned totally with the pre-prepared implant planning. So if the surgical guide is accurate, so it's very easy to prepare the immediate temporary crown together with the surgical guide before attending the surgery, because this scan body, when introduced to the CAD software, the CAD software can correlate this scan body with the artificial intelligence way in order to put the abutment and build the temporary crown on the abutments. So this makes it possible to make immediate provisional restoration or to make immediate loading. So these are some cases. I'm gonna show like 2 cases. First case, and this is one of the limitations of the surgical guide, that here the patient want to extract the 2 lower central incisors and make immediate placement of 2 implants. So this space is very easy to be restored because mesiodistally you can put the 2 implants with a good safety margin if you are doing in freehand technique. But in case of the computer guided surgical stent, you have the space for the sleeves. So you have the space for the sleeves here, which can collide together because the space is narrow for accommodating the sleeves with the sleeve support. So the solution for this case, that 2 surgical guides were made, one for the right central and another one for the left central, were designed and then 3D printed to 2 surgical guides. And this is the post-operative CBCT for the case where the 2 implants were inserted. Case number 2, and this is a very interesting case. This is immediate temporization or immediate loading for a single restoration. In this case, this patient had a remaining root of the upper right lateral incisor. Here, this is the CBCT for the patient. And this is the bone measurements for the implant site. You can see here, this is the buccolingual width and the length of the bone. And the implant size was chosen. Then we have here the optical scanning for the jaw of interest as well as the opposing jaw. And digital smile design were planned, and a virtual crown or virtual wax up was made. So here it is made based on the opposing and the adjacent teeth as well. So here, integration of the CBCT with the model together with the virtual crown or virtual wax up. Okay, so here this is the virtual crown, and this is the model of the patient. This is the prosthetic-driven implant planning, and we can see here this implant is aligned such that the lingual screw channel can be done for screw retained restoration. Sorry. Here we had another problem. We had a narrow mesiodistal space for a regular white sleeve. Therefore, a narrow sleeve was done, and the guide used in this case was a pilot guide, that we use the guide for only the pilot drills only to be used. So surgical guide design was made and then 3D printed. Now here, also one of the tools exported with the other tools is the virtual scan body. So here the scan body was the virtual scan body was exported with the model, and then from this scan body, once imported to the CAD software, abutment and the crown can be designed, and then it was milled in PMMA. So here, this is the CBCT, and this is the integration of the model, and this is the opposing, and this is the crown of the patient. So here, this is a scan body. The drill was used to drill for the implant, and the implant was inserted. And then the abutment was inserted in the implant, and then the crown. And this is the immediate temporization, which happened in the same day of surgery. This is the post-operative CBCT for the patient. And here, superimposition of the preoperative planning on the post-operative CBCT of the patient, and you can see here the error was very low. And this is a video for the case.
Dr. Ekram? Dr. Ekram, we do not hear you.
Hello? Hello?
Okay.
Yeah. Okay. Can you hear me now?
Yeah. Now, yeah.
Okay. So now I'm gonna. This is the end of the presentation, but I'm gonna show some stuff live on the software. Our software today is the Real Guide. Gonna see some maneuver which may be very important for the using the our planning.
Okay. So if you wanted to show us the software, yeah?
Yeah.
Okay.
I have already cases, and I'm gonna just
Let's go to see them. In the meantime, there is a question about
yes.
the Real Guide software. If it is free to download, yeah, you can go on our website and download it. For 30 days, you will be able to use the software in a pro mode, so you will be able to use all the implant library we have into the software and do all the planification you want. At the end of the first 30 days, the software will be only in mode of diagnosis, and then you need to subscribe to a license for 1 month or plus, or buy it from us. Please, Ekram, continue.
Okay, any other questions asked before I proceed with the software?
And they ask you which software do you use in order to superimpose post-operative to implant planning.
Okay, actually, my software, which is the radiology software, is called the On-Demand 3D. We use it to superimpose the both CBCTs together, the post-operative and the pre-operative. And then after these two CBCTs are aligned, then the old tools, the export tools that we have, like the implant, like the other tools, when you import it to the post-operative CBCT, it will be perfectly aligned with the post-operative CBCT, same way like it was aligned with the pre-operative. Okay, so this is the way I align the tools, align the CBCTs pre-operative and post-operative together exactly the same, so that the pre-operative tools that I had before will be perfectly aligned with the post-operative CBCT. Okay, so I can see here like 6 questions or something.
Yeah. Now we are preparing a link for you in order to copy the link for the software download into the chat. I don't see now other questions. So if you want, you can show us your cases, and then in the meantime, we reach some questions about your presentation. Okay?
Okay. So this case, it's all on 4 case. I'm gonna just hide all of the tools just to show something which is very important during the implant planning. So here, in all on 4 cases, the distal implant is inclined with the like 30 degrees to the occlusal plane towards the medial side. So it's very difficult to make it like freehand. Here, this tool is very important. Like we can insert here the angle that we want to make. So here we can, I'm sorry, but something is hiding. So here we can put the, I'm so sorry, but something from the broadcasting is hiding the tool. So, but here you can insert the number of the angle. Here it is 32. You can insert it into 30 or whatever, and then place the implant in the way you want. So it will be inserted in the same maneuver like this. Also, one more important thing that is the automatic alignment of the implants together. So, for example, if I have this implant, I can make the implant aligned parallel to the tooth number 2, for example. So here, because of the sleeve. So here I align the 2 implants perfectly parallel to each other in order to be assured that my planning will be okay. And this case was an all-on-4 case. It was done here. So this was an all-on-4. Of course, I have damaged the planning, but this is the all-on-4 case was done to for this case. So also another maneuver that there is something what we call the smart or the artificial intelligence, that you can remove one tooth from the CBCT as if you have extracted the tooth. sorry, here there is no teeth. I'm gonna go to another case. Like this case. So the tooth segmentation, that here you can segment one tooth. Let's say, for example, gonna segment this premolar. I should make the long axis aligned with the tooth. So here, when we press Control and left click, here I can find the tooth. The interesting here that you can correct this alignment on each layer. So you can see this one part is not aligned, so we can go to next. And then we can use the Paint 2D tool in order to see. So for example, this part, we can see it is not marked. So here I can mark it and then add it to the volume. And then here I can modify or fill any gaps or any like here. And this is very important in the maneuver of making like bone grafting or something. But this update is actually recent. As you know, we were using, because we are old users of real guide and 3D diagnosis. So this tool was not available in the old versions. And this is very important for making something like a graft or a virtual graft, for example.
This is a tool available starting from Pro version. So the software is divided into different modules: Start, yeah. Pro, Design, and CAD. Starting exactly. From Pro, which is also the first version you need to subscribe or buy, there is the possibility to segment the bone and the teeth. So,
exactly. Okay. And the bone, as shown in the video in the middle of the presentation, this was done for segmentation of the bone, that you can segment the bone. And if there is any missing part, for example, let's see here as a practical app. Let's go to the previous. If you go to bone segmentation, for example, here.
We are going also to share on the into the chat the previous webinars we did about these specific arguments, in order to allow also to our participants to know something else about segmentation or Pro Design, which is the difference, and so on. Okay. But if you have questions, please write here, and then me and Dr. Ekram, we are going to answer you.
Okay, so here if we make segmentation here, because this Paint 2D also can be useful in the bone. For example, when you make segmentation for the bone, it will not all the bone volume will be scored in the segmentation. So therefore, let's see. So this is the green areas that we have here. Which is called like the bone. Okay. So let's see here, for example, on the cross section. There are some parts. Okay, this is. Okay, maybe
I think you need
something happened. Yeah.
To make a new choice of the threshold.
Yeah.
Because,
yeah.
Okay.
Because,
or
anyway.
cut,
so like. So here I'm gonna go again for bone segmentation.
Okay, it's okay.
Okay. And then here we can go to the
Okay, now.
so here we can see the bone is a little bit having some defects. So let's see here in this bone, we have this part is not recorded. So when you go to next step, we can make like correction of the bone here, layer by layer, and in any other cross section or longitudinal or whatever the plane you are using, or even the axial here, for example. So here is very important because in cases of bone reduction guide previously, we have a big problem in the maxilla because the maxilla is not recorded well. But now, after this update, because it's very recent, I believe, so now it's possible to make bone reduction guides better and make bone supported surgical guides with the maxilla. So these are some important tips that I want to show about the software and the cases. And actually, if any doctor, colleague, or someone who has any questions, I will be happy to answer.
Okay, so please write into the chat the questions you have about the Dr. Ekram presentation. We are waiting for it.
Okay.
In the meantime, I don't know if you have other patient to show us
Yes.
or cases. In the meantime, you prepare the case. I can say to you that the software is divided into different modules. We have the free version, which is called Start, that allows you to do all the diagnosis you want about your CBCT exams. The Pro version, which is the other one, allows you to make planifications. So select the proper position for the implant and do a project. But if you wanted to design your surgical guide and export it, you need the design version, which is the third one. And with design version, you are able to do all the project you want and export all the planification you did into STL file. And so you can use the STL files in all the way you want, because our software is open, is free. So import and export DICOM and STL files. So please, Dr. Ekram, continue.
Okay. No, actually, this is the two cases that I want to give about the tips. And actually, new video is gonna be done for more advanced maneuvers for bone reduction guides and for some maneuvers that I'm waiting in the real guide, because I believe the new version will gonna be having big updates. But now. Anyone who wants to ask anything, or even after the day finished?
On the Facebook Live are asking if you can show how to design a surgical guide starting from the planification. I don't know if you can now.
Yeah, sure, it's okay.
Okay. So if we can start from a project without the surgical.
Understand, yeah, okay.
Okay, thank you. Maybe you can also delete the surgical guide and then recreate it. Okay.
Yeah, of course.
Okay.
So this case, Okay, from the beginning, okay, I'm gonna just erase what is done. Okay, so in the beginning, first we should trim any unnecessary areas on the CBCT in order to make the file a little bit not heavy. So it can be done like along fixed planes by the option of permanent trim. And also can be done like custom made if I'm gonna remove area like this and by sculpt, for example. So, and this is very important because most of the software, they only allow for the constant trimming, not the custom one. And it's very important to remove the upper jaw from the lower jaw. Then here, data import, here we should import the model. I'm going to align the model. So here, I make alignment for the CBCT with the model. So I use solid points which cannot be mistaken easily, like a cusp tip, like a point angle, something like this. And we choose points at the buccal side and points on the lingual side, one by one. And see, for example, like this. And then we go to fit points. We choose similar teeth here. Here, the model is aligned with the CBCT, and then make best fit. You will see here, this is the delta value that we discussed before. It's written very small, but it's 0.083. This means that the alignment is good, is acceptable, or is very good, because below 0.1, this means that the alignment is good. And then we go to the next, which is the arch curve. So the arch curve, we make it at the level of the crest of the ridge. And then here, I'm gonna just delete the curve. And then draw a new arch curve. Here, in order to see the whole length of the jaw, we should increase the panoramic region. And we can see with this line, after making the arch curve, we can adjust the panoramic in the middle. And then the nerve, I'm sorry, it was already aligned before. So, but here in the nerve, we used to, we put the points here on the cross section. And then point by point until we should adjust it on the panoramic as well as the cross section. Here, because I already moved this area doing sculpting, so I'm just going to remove the points. So here we go to the next step, and here I have the nerve with the CBCT. here because this was already aligned before. So first we have to put the cross section on the area of the tooth, and then here we should choose the tooth number 45. So I have to get out and then return back again.
If you want, we can also insert only one sample implant.
Yeah. I'm gonna put the problem is that everything was done before, so when I make cutting of the CT,
Okay.
every alignment was cancelled.
Yeah.
Here we put the tooth and then we adjust it. From the corner here, we can rotate it and make it aligned with the neighboring. Then we can rotate it from both the 3D and the 2D images. And I think it's from the CAD software will be much take less time. So here I make first the alignment of the crown, and again I'm gonna use the implant planning. So see here, we should get the cut to be in the middle of the wax up. And now here we choose the implant that we're gonna use. For example,
here we can see our implant library.
Yeah.
Which is open, so you can find all the different
and here not all the implants are open. You can download whatever you want in order not to make the software heavy. So you can download whatever implants that you want from the library. So for example, here I can choose like any implant and see in by Horizon, for example, all the implants are available, the models, and here the sizes. So let's, for example, choose 3.8 by 12. And then here it gives alarm that the nerve is near. So I have to use shorter implant. Now it's giving yellow. Now I have to align tooth with the crown. And then here we make it as much fatter as possible. And then the next, of course, I'm making it quickly. So here it's possible to get an implant report. You can put the name of the patient, for example, demo, and the clinician, and the implant. And here, if the implant is loading is immediate or no, we don't know. So the guide is tooth retained, it's custom because part in the tooth and part in the mucosa. And here's fixation pins. Yes, it will be. I'm gonna put the fixation pin now. So we can make the report here. And then okay, I'm gonna show you the report at the end of the, and then we can go to the next step.
So did you here choose the sleeve because
I didn't choose the sleeve. No.
Okay.
So here, this is the implant. You can change the implant from here and choose the abutment from here, and this is the sleeve. So here you have the sleeve. It's automatically gone on by Horizon. So here are all the range of sleeves. So you can choose whatever sleeve you want. For example, like this. Also, it's possible to create your own sleeve. So for example, if you go to custom, this is a list of sleeves that I have created, and you can create your own sleeve from here. For example, and this is the parameters of the sleeve that you can modify here. Okay, and then so this is the export and report, and then here is the object list that you have. This is the objects that you have here in the plan. So you can hide or choose or whatever. Now we go to the guide design. Here I have to block the undercuts below the height of contours in order to be able to see the guide properly. So here I have to make this arrow like a point when you see from top view. So, and here we generate the undercuts. Of course, all of the offsets on this stuff is can be taken later. So here the undercuts is blocked. Okay, and then when you go to the next step, we can see here the parameters of the guide, the offset, the occlusal thickness, the primitive thickness, or whatever. And then we can draw our surgical guide. And here it's very important that these lines, when drawn, nothing should be hidden. So we should add points on the line, and then these lines should be all showing, like here. And then we can connect the last 2 points together. And then we can modify the guide by adding points like this, and then here we can tell create guide. So let's see, after making the guide, if I want to modify, what can I do? So here, this is the guide. Preferably, I should fill any sharp areas should be filled in order not to make any stress concentration during printing. also we can smooth any sharp areas like this. Okay, and then we can add or fill or whatever. And then here we can create window on the surgical guide. This is the window size. Okay. For example, here, this is the window, because sometimes I have to check clinically after. So here I'm making a window between the contact points of the two neighboring teeth. So here I've created the window. Okay, so let's check the guide. So here I forget to do something. Sometimes here I must put a fixation pin. So if I want to go to modify it, I go to create guide again. So it will ask you either to create a new guide or modify an existing guide. No, I want to create a new guide because I want to go to the planning again and then insert a fixation pin. So this is the location of the pin. So I can put the pin here on the cross section. Again, I move it until it is away from the implant or any vital structure, and then go back again. And then design the new guide.
Okay, there is another question about the sleeve you are going to choose.
Okay.
Because they say, why do you choose different sleeve? What is the correlation between implants and sleeve? Okay,
okay. So each implant company have a set of sleeves and have a set of guided drills. Okay. And these sleeves and guided drills are they made it matching together, and there is two distances. There is an offset distance. Let me show you on the implant planning. When we say here, for example, change. So here, when we see here, this is the sleeve dimensions, and this is what we call the offset distance. So this is equivalent to the drilling depths. So each implant company has a set of drills with certain lengths and diameters. So they make their own settings based on their drills. So this is how it goes. But if you have your own system, like universal system, like of 3D or something, you have many lenses and many parameters, so that you can manipulate in these distances by yourself. So this is why. But each company has its own settings which they preset before they work.
We can also say that anytime you are going to do a planification, you have not only to think about the type of implants you want to use, but also the surgical kit you want to use. And so, depending on the surgical kit you have or you need, you can choose the proper sleeve for the implant. Sometimes the sleeve is automatically put by the software, because there is a correlation between the implant company and its surgical kit. So the first choice for the sleeve is the original sleeve are correlated to the implant. But if you want, you can change. And also, like Dr. Ekram showed you before, you can add your own specific custom sleeve. So you can take the parameters, measure them, and then insert them into the software. So depending on what you want to use as kit, you choose your sleeve.
Let me say it in another way. Like, we have two types of drilling kits. We have universal drilling kit, like 3D, for example, and we have specific drilling kits that each implant company has its own kit. So the kit must be compatible with the accessories that is used, which are the sleeves and the pins and pin sleeves. So you have one of the two tracks you're gonna choose. You're gonna choose to go to the track of the universal stuff, or the track of the specific stuff related to your implant system. So this is it.
Okay, so we see if there are other questions, but I think not. We are going to finish our webinar or presentation. So if you have other questions, please write here now. Otherwise, we can finish our meeting. This meeting will be, it has been recorded, so it will be available on our website if you wanted to review it, or also you can see it on our Facebook page if you want. No question.
And any questions on the Facebook page, I can answer at any time, no problem.
Yeah. So, but I think there is not something more. No.
Okay.
It was everything clear for all participants. So thank you, Dr. Ekram, for your lecture, for your webinar, for coming here. And thank you to everybody for following this presentation. You can find all our presentation and all our webinars on our website. So if you want also to understand something more about the software, you can or relate to Dr. Ekram or write to us an email, and then we will send you all the info you need. I'm going to write here into the chat the email you need. For tech questions. For sales. And there's another question. In the meantime, if STL exports are free or purchased, it depends on the type of license you buy. If you want to be able to export STL files, you need a version design. Starting from the design, you will be able to export the STL files. If you buy the software for the first year, you will be able to export freely for all the year. At the end of the year, you can decide to continue to export without any limit, and you have to pay a membership, or you can decide if you want to play each STL export you do for each case. So you can decide what you want. But please remember that on our website is also available the possibility to subscribe. So you can do a subscription to our software, and so you will be able to export the STL files during all the period of your subscription. An example for a design version. I don't know if Dr. Ekram, you wanted to say something else about?
Actually, there is, I believe there is a new CAD software for making restorations. I think we should need to do something about it, because I checked it. It's very nice that this software is having like a very good package, that it's flexible, having the facility to import any of your custom settings. That's it. So anyway, this we're gonna have, of course, a lot of questions. I know it's a learning curve. So and we are
if you
ready
wanted to write also your email into the chat, so the participant will be able to be in contact also with you.
Yeah, sure. Okay. So
And
I will write it when I just finish the webinar. I'm gonna put it on the Facebook, or I don't know which chat.
the meeting will be available at the end of the webinar, immediately on the Facebook page, so you can share it everywhere you want. And if you need the recording, you can download it starting from tomorrow from our website. So you can find it here. Okay.
Okay.
So thank you very much for coming here, and thank you very much, Dr. Ekram, for your presentation.
Thank you very much. Okay, see you.
Bye-bye.
Bye-bye.